I'm going to turn it over to Lisa Opipari and Julie Stone to give us an overview of another trial with a different novel design called the Produce Study.
Hi, Sarah. Hi, everybody. Well, I'll introduce myself, and then Julie, you can introduce yourself, and then we'll get started. So, as Sarah said, my name is Lisa Opipari, and I'm a researcher. I'm a behavioral scientist by training at Cincinnati Children's Hospital, and I've been working with the Improved Care Now network in various research projects for probably at least the past 6 or 7 years. So I'm really excited to be able to be part of the virtual community conference tonight and share with everybody some of the a new study that we have started in the network. Julie, can you introduce yourself really quickly?
Yep. So I'm Julie Stone. I'm one of the parent reps for University of North Carolina. I have a son, Lucas, who is 12 and was diagnosed with Crohn's disease about 4.5 years ago. I got involved with ICN about a year after his diagnosis, and then soon after I joined the research subcommittee. So when Lisa's done, I'm going to speak to you a little bit about the idea of parent co-production from the perspective of a parent.
Okay, great. Next slide, Sarah. So tonight we're going to be talking a little bit about the Produce Study, which is a newly funded PCORI study within the ICN network. Produce, the name Produce, was chosen by the community. We had a competition for people to submit different acronyms for the study name and then to select the study name, and it stands for Personalized Research on Diet and Ulcerative Colitis and Crohn's Disease. Next slide. So first, just to introduce you quickly to our study team, there are myself and Heather Kaplan are the co-investigators or principal investigators who are leading this work, and then some of the other ICN physicians who are closely involved with this work is Dr. Shahzad Saeed and Dr. David Suskin. Peter Margolis, who I know everyone heard from, also has been part of this team as well. And then we also have dietitians, Kim Braley at Seattle Children's. Next slide. And then several parent and patient partners, as well as Sunny Tucker, who is our study project manager. And I will hold off on saying more about our parent and patient partners and let Julie talk a little bit more about that at the end of this talk. Next slide. So what is the Produce Study? The Produce Study is going to examine how nutrition impacts symptoms and inflammation in pediatric patients with IBD. We're going to be asking the specific question of whether a wholesome diet, in this case, the specific carbohydrate diet, can be used as a treatment therapy. And we're really excited to launch this study. The work on this study, well, it started a couple of years ago, but the study itself actually started in January of this year. So we're in the very early planning and development stages of this work. And one of the reasons we're so excited about this is because it's really been, the idea has come from the ICN community, and the study is being developed in collaboration and very closely with patients, parents, clinicians, and researchers within the network, much as what Dr. Kappelman was just explaining a little bit earlier about how the idea came about through research being prioritized at one of the learning sessions, ICN learning sessions several years ago. That too was where the idea about studying diet and learning more about the effects of diet on IBD came about and was generated from our community, and that led to the development of this study. So why is the Produce Study important? The role of nutrition interventions in IBD therapy is one of the most frequently asked questions from patients and families. And yet there's really not a whole lot of data to be able to guide people in what to do, and if nutrition interventions make a difference. So there's growing evidence to show that diet has an impact on disease activity for patients with IBD, but large multi-center center studies are really needed for us to learn more about how what children and teens eat may impact the IBD. Next slide. And so what we're working on, the goal of this study is to compare the effectiveness of a strict specific carbohydrate diet versus a more modified specific carbohydrate diet. And we're looking at the effectiveness of these diets in reducing symptoms of IBD using an N of 1 study design. And so there's a couple of terms in here that are highlighted in green, the specific carbohydrate diet and N of 1 study, that may not be everyone may not be familiar with. So I just want to spend a moment just talking a little bit about these. Next slide. So the specific carbohydrate diet is a nutritionally balanced diet that focuses on natural nutrient-rich foods, including vegetables, fruits, meats, eggs, legumes and beans, nuts and nut flours. It removes things like grains, processed foods, dairy, except for specific aged cheeses and fermented yogurts, and sugars except for honey. So that's the basic idea of what the SCD is. And we're testing the traditional SCD diet against a modified SCD diet, which adds back in a few of the typical foods that patients and families tell us they miss most and would be, they'd like to be able to add back in if at all possible. So that's what we're comparing in the study, and we're comparing both of those diets to someone's baseline or usual or their regular diet when they come into the study. Next slide. The way we're doing this is something that we're using an N of 1 design. The N of 1 trial is the most patient-centered research design available. And the goals of the N of 1 trial are to determine the best intervention for an individual patient using data and a very rigorous systematic approach. So unlike a randomized controlled trial, which is in some thought of as the gold standard of how we evaluate different treatments, the N of 1 looks at an individual patient and how an intervention is impacting or affecting them. In a randomized trial, we're looking at groups of patients and how does an intervention affect one group versus another. It doesn't tell us anything about how you may have done or how the intervention may have impacted you personally, but just how it impacted the group that you were in or that was testing the same diet or same intervention that you were on. And so we're really excited because N of 1 results, when we're running N of 1 studies, they allow us to apply the results to the participating patient, and that patient can get the information back to say, did one diet make a difference for me? Was one better than the other? And did either make a difference compared to the diet I came in on? The exciting thing is that with statistical methods, we can also combine multiple N of 1 trials from everybody who's participating and get an estimate of overall group treatment effect. So at the end of this study, our patients will be able to say how the diet impacted them personally and have that personal information. We also will be able to say as a network, based on the group of patients who were in the study with these characteristics, here's what we think about the specific carbohydrate diet and how it may or may not impact symptoms of IBD. Next slide. And so in terms of, why use an N of 1 design, like what we just talked about, traditional research approaches do not provide answers for individual patients, and an N of 1 design does. And we really are needing to shift from the one-size-fits-all approach when we're doing research to one that enables personalized decision-making for each patient. So we're really excited to have the opportunity in this study to not only examine diet and its impact in IBD, but also to use this N of 1 approach and learn about it and see how it works and how what it can teach us about doing research in our network. Next slide. So to tell you just a little bit about the study, I'm not going to dive into too many specifics. I'd be happy to talk more to people, give people lots of details about it, and there'll be more and more information coming out about this in the network and on the ICN website. But we plan to enroll 120 patients with diagnosis of IBD between the ages of 7 and 17 years. The enrollment period will start at the end of July. So we're moving very quickly to be able to enroll our first participant, and we anticipate enrolling patients in the study through January of 2019. Next slide. We have selected the centers where we will start this work. So we plan to, at this point, partner with 12 ICN centers, and these are the centers who, on this slide, who are going to be participating in this study. Just give people just a second to look at these, and then next one. In terms of what will happen in this study, just to give you a very high-level overview of a patient's experience and how N-of-1 will work, what we'll be doing is that when a participant comes into the study, they'll be on their usual diet, and they'll stay on that diet for a couple of weeks so we can learn about what their experiences are and what their symptoms are like on that diet. They then are going to alternate between these two different diets I talked about, the SCD diet and the more modified version of the SCD diet, 2 times. So they're going to switch back and forth. They'll be on each diet for about 8 weeks. So SCD for 8 weeks, switch over to the modified for 8 more weeks, switch back to SCD, and switch over to the modified again. And people will be randomized to which diet they actually start with, but then they'll just switch back and forth. So that's a general sense of what will be going on. There'd be, next slide. Patients will and parents will be using a mobile app that we're designing for this study to record daily symptom data of what they're experiencing, what their symptoms are like. We'll also be looking at measures of inflammation through fecal calprotectin, where stools will be collected once during each of those periods to get that measure as well. And at the end of the study, then patients will receive personalized results about the impact of the diet, so database results on, on their symptoms of IBD, both their reported symptoms and their inflammation. And then all of the N-of-1 studies will be combined, so we can learn about the effects of diet at a more broad or general level in IBD. Next slide. And so I am going to stop there and turn it over to Julie, who's going to talk a little bit about her role in the study and her experience with the produce study.
Hi. So as Lisa said, I'm going to talk to you a little bit about the parent co-production from a parent's perspective. So over a year ago, Lisa and Heather reached out to the research subcommittee in hopes of finding a few parents interested in what would eventually become the produce study. Luckily, I was on the call and was one of the 3 parents that volunteered. Giselle Woodward is one of the other parents who volunteered. Her family has been following the SCD diet for over 7 years. Her husband, son, and daughter all have Crohn's disease, so she was very motivated to give SCD a try. Sherry Pilley also volunteered. Her son has Crohn's disease, and her family has been following the SCD diet for over 2 years. They chose to follow the SCD diet because they saw how successful it had been for Giselle's family. And Alex is involved just because Alex is awesome. I can't really say much else about that. But both Giselle and Sherry have become experts on the diet and were very obviously the perfect parents to be part of this research team. My son isn't on the SCD diet, but he's been using diet to help control his disease since he was diagnosed. He relies on enteral nutrition to help achieve and maintain remission. I have thought all along that diet is an important factor, and I know as a parent I'm not alone in this. Unfortunately, there really aren't any answers to the loads of questions we've all been asking about diet as a treatment for IBD. So I volunteered. I wasn't really sure what my role was going to be in the beginning. I knew that I could provide marketing and design help with the education material. This is something I'd already done in a small way with the combined study because of my involvement with UNC and being part of Mike Kaplan's ICN team. So I had a little confidence that I could be useful, at least in this one way. And I wasn't really sure what to expect and exactly what parent co-production would look like, but I have to say I'm truly impressed with how seamlessly this whole process has gone so far. All the education materials that we've created are great, but I cannot imagine them being half as good as they are without Sherry and Giselle's involvement. I can't speak for the rest of the research team, but I can easily see what an amazing resource they are. And I imagine that their passion alone can only increase the chances of this study's success. Additionally, I think that these parents are a perfect example of something David Wall mentioned earlier about dissemination. These parents are going to disseminate study results in a new way. They're already very involved in various STD communities, including this really great Facebook group, and they're going to increase the number of people who will even know about this study. And then I'll quickly give you one small example of why I think parent involvement or co-production is great before wrapping up, because I know we're limited on time. We recently had a call to discuss the design progress of that phone app that Lisa was just talking about, that's used to track patient information. So obviously I know that the app would be created regardless of whether parents are involved or not. I imagine though that the research team would probably have spent a fair amount of time speculating on what information parents wanted to see, how they wanted to see it, etc. But having 3 parents on the call allowed the team to simply ask us, what would you like to see? How do you want it presented to you? Do you like bar graphs or pie charts better? So instead of having to speculate on what parents might want, they were able to streamline the process by getting an immediate reply from the parents themselves. I'm very grateful for the opportunity to be part of the Produce research team. I think it will not only be a study that answers some questions about diet and IBD, but it will also be an example of why parent co-production is so important and how to navigate this concept successfully.
Okay.
That's the
yeah. And I think, yeah. So I think that's it from our end, unless I don't know, Sarah, if there's time for questions.
Yeah, there's absolutely time for questions. I think you had about 2 more slides if you want to just quickly.
I think we're good. I think we were good with them, but.
Okay, perfect. Thank you so much. I love, Julie, how you kind of shared your perspective on what it feels like to be the parent partner. I think that was, I learned a lot just from listening to that, even though I've worked with you all for quite some time. So thank you so much.